Greetings, everyone. My name is Dylan, otherwise known as Embrace the World in Gray. I am coming to you from the Chicago suburbs. For those of you who are new to watching my videos, thanks for taking the time to learn me and what I've been going through. I am 9 months post-op from pudendal nerve decompression surgery. It's a rare and controversial surgery for the treatment of pudendal nerve entrapment syndrome, which is a rare pelvic pain issue. Most people don't know that they have nerve entrapment syndrome until they go in with surgery and figure it out. I was suffering for about 7 years before I decided to take the plunge and go ahead and go through with surgery. A lot of people with pudendal neuralgia in general, it's a very long process to get to the surgical point. Many years of ruling things out, many years of doing different treatments, more conservative treatments. And when those treatments fail, you kind of think, well, let's give this a go. The pudendal nerve is the main nerve branch that controls the pelvic floor, both left and right-sided. My PNE is on the left. It basically invokes a lot of stabbing, stinging, shooting, shocking type neuropathic pain in the pelvis, which affects my tailbone, deep gluteal, vaginal, and urethral, just to name a few. People with PN present in all types of different ways. Some people only have a small chunk of the nerve branch affected. However, mine is affected the entire nerve branch on the left side. So starting from the sacral nerve roots, S2, 3, and 4, all the way down to the vulvar area of the pelvis. And it greatly affects my life. I can't sit, I can't drive, I can only stand for short periods of time. I'm pretty much in constant discomfort to some capacity. I have been exploring other medical issues that contribute to my PN. However, my PN was the main symptom that I was dealing with for 7 years, so I focused on that a lot. However, in the last several months, I've been going down different roads and I've discovered a really lot of things that contribute to neuropathic pain and autonomic nervous system dysfunction, which I've been dealing with too. However, I'm going to try to focus this video at least up until March, because in March I'll be 1 year post-op. I'm going to try to focus on the pudendal nerve issues that I've been having in order to reach a wider audience and to help those strong people who are also fighting with pelvic pain and pudendal neuralgia. It comes in many different forms, caused by many different things, and it's very hard to pinpoint the systemic mechanisms that keep this pain going. A lot of it is thought to be a functional nervous system issue, so much like if you cut off a limb of someone, they have phantom nerve pain. Even if you fix the problem physically, your central nervous system is still sending inappropriate messages, which I believe to be happening with me. I'm 9 months post-op and I haven't noticed any type of change in terms of nerve pain. It's pretty much, other than the intensity when the episodes get really bad, has increased, but overall it has not really changed from pre-op. It presents pretty similarly in terms of location. However, in terms of type of pain, sometimes it's stabbing, stinging, sometimes it's a really dull aching, deep ache, sometimes it's like electric shock type of feeling, like zapping type of feelings. I've actually noticed those types of feelings have decreased. My symptoms revolve around any usage of the pelvic floor, so anytime you're using the bathroom, me particularly, I think anytime there's food moving through my digestive tract, it puts pressure on the rectum and in turn puts pressure on the nerve. I In terms of how I deal with the pain, which is, I keep getting questions on how I deal with this type of neuropathic pain, and honestly, it's been 7 years and I really don't have answers for that other than just cope and exist. My quality of life is next to none right now. I mean, well, moderate to severe, I would describe. I mean, yeah, I can walk. I can walk for about 20 minutes at a time, and then I need to lay back down. I can do certain tasks around the house here and there. I can clean, prepare some meals. And most importantly, I can work a remote job. However, I am shifting positions constantly and it's very uncomfortable. Um, so, it's not like a normal life by any means. I can't wear pants or underwear, because anything in that area just sends the allodynia through the roof. And for those of you who don't know what allodynia is, it's basically an oversensitized um, response to a non-painful stimuli such as touch. If you think of it in terms of like a broken stereo with the left speaker being on 2000 and then the right speaker being at 100, it's like the nerves are just so oversensitized that any type of thing, it's like way too strong of a feeling. And that's what happens with neuropathic type of pain. I am considering doing some sort of spinal cord stimulator. They have different brands and different types, and the technology is always improving. So basically, they place the leads internally, and it's a small device that you do a trial with, and they place it either on the nerve roots themselves or somewhere distally in the spine or on the peripheral nerve branch. I've considered doing that. However, I'm probably going to wait until at least March. I'm going to reconvene with Dr. Hibner and see what he has to say. I am not open to doing any more injections, no more steroid injections, no more Botox injections. I've been through the mill with that, and all it does is flare me up even worse later when it wears off. Steroid injections only give me about a day of relief, and then it comes back twice as bad. And Botox injections work on my muscles, but not at all for my nerve pains. So, and then when that wears off, I feel like that was the most detrimental to me when the Botox wore off. And in my medical journey, I discovered that I have a connective tissue disorder called Ehlers-Danlos syndrome. I'm about to send in my genetic tests to see if any of the more classic and or severe types of EDS will show up on the test, which I'm not entirely convinced I have any of those types, but the symptoms of EDS overlap a lot, so it's very hard to tell which type of EDS you have. And the most common type of EDS does not have a genetic marker at this moment. However, research is being done, and the EDS Society is being funded very generously. So it does give me a lot of hope. Everybody with EDS wears it differently. The stereotype is that you're hypermobile and that you're super flexible. You're doing splits, you're bending your elbow and shoulders in really weird ways, and sometimes it's very subtle and it can be overlooked. In my case, I believe that my muscular system is grossly overcompensating for my organs and my joints moving in ways they shouldn't be, and causing all types of pain issues and horrendous nerve entrapment issues. I also discovered I have multiple vascular compressions, mechanical compressions, the most significant being May-Turner syndrome, which is the left iliac vein being compressed by the right iliac artery. I am stented. It was found that I was 74% blacked, and I have not really noticed any type of change in terms of my nerve pain. However, I've noticed some changes in like my abdominal symptoms. So, just kind of waiting and wishing at this point. I'm lucky if I can get on 2 walks a day. It is winter in Chicago. It has been in the 30s, and January and February come snow and single-digit temperatures. So I need to find a different way of exercise, and I need to find, there are some workout videos for people specifically with EDS who are terrified to move and injure themselves. So that would be my next endeavor. In terms of pudendal nerve decompression surgery, for those of you who are considering going through with that treatment option, I would advise you to wait as long as humanly possible to go through with that option. It is a miserable year. It is a miserable year. And I do believe people improve after nerve surgery. However, it takes up to 2 years to notice any type of nerve changes. Your body does not prioritize nerves and ligaments to heal. It will heal blood vessels and organs before anything. So my advice is to wait as long as possible. Try a spinal cord stimulator. Try any other treatment. Try investigating other mechanisms for causing pain. Anything prior to the surgery. It is very grueling. And I'm not trying to say that there aren't, like I said, there are people who I've spoken to that have had good results. It's just a very, very long time, and you will need to alter your entire life. You will not be able to work. You will need to have disability in place prior to doing the surgery. That's my best advice for people who are considering. And research the surgeon. Make sure the surgeon has experience. If anything, travel to Europe. They're way, way, way better at handling pudendal nerve entrapment than the US. Pudendal nerve entrapment is very controversial. People have argued that people who have no symptoms whatsoever of PNE, cadavers of those people's bodies showed that their nerves also had a lot of scar tissue. Basically, they go and cut ligaments and they clear the scar tissue away. So it's very debated on if this surgery is effective or not. And there's not enough studies about these surgeries. Most of the people who get better from this don't ever give data. You're mostly going to hear bad results. However, that's why I'm trying to stick around and continue to tell my story and continue to talk about pudendal nerve entrapment and Ehlers-Danlos syndrome, and more education about Ehlers-Danlos syndrome. Doctors don't really treat people with EDS any differently than they do their other patients, even though they know what it is and they know that there's a lot of tissue and vessel fragility and hyperextendability, including organ prolapse. That's very common in EDS. However, they don't really treat us any differently. So advocate for yourself, fight for yourself. Do not take no for an answer. You need to go into the doctors and tell them exactly what they need to rule out. And even if you don't have classic symptom presentation of a certain thing, you need to fight for yourself. And that's my best advice on chronic illness and pudendal nerve entrapment syndrome. Thanks for listening, and I will talk to you guys in a week.